Turning now to the latest on the pandemic. Take a look at this chart. It shows the number of Americans who died from COVID over the past 3 years. After all the peaks, the deaths are finally trending down. Next week, the U.S. will end its COVID emergency. But what does that mean in practical terms? CBS's Elise Preston went searching for answers. Good evening, Elise.
Good evening to you, Adriana. This is the first spring in 4 years where COVID actually seems to be in the rearview mirror. Many who have suffered from COVID fatigue more recently have hoped for someone to put an end to this emergency. Now it's official.
The reign of COVID began with the world under siege, the global pandemic killing nearly 7 million, infecting more than 750 million people, spreading fear and panic. On Friday, this from the World Health Organization.
It's therefore with great hope that I declare COVID-19 over as a global health emergency.
Is COVID over?
COVID is not over. There are still more than 1,000 people a week dying from COVID in the United States alone. We are definitely not out of the woods yet. All the advice that the CDC and others are giving about getting boosters, that applies. And I don't think that's a good idea for people to just say, you know what, out of sight, out of mind.
There's a new normal. It may mean no more COVID dashboards, no more White House briefings. But in its wake, more than 1 million Americans have died, an unimaginable toll. There have been more than 100 million cases. And while Americans no longer have to mask up, Dr. John LaPook warns not to let your guard down.
People who are vulnerable are still going to have to be careful, because if they get COVID, they could really have a bad outcome. I mean, the people who are vulnerable in our society tend to get left out.
Next week, the White House will end some vaccination requirements and COVID policies. Dr. LaPook warns millions who are underinsured will no longer have access to free COVID testing. Adriana?
Elise Preston, thank you.